Today I want to talk about atrial fibrillation. Atrial fibrillation, or in short called afib, is a condition where your heart beats irregularly. Um, Different people have different symptoms of afib. Some people actually don't even know they have afib. For me, I definitely experience afib. My experience in afib is actually pretty pronounced, sometimes severe, and I would say very scary. Um, Here's a link that I'm going to show you in the description, but I can also read it to you right now what atrial fibrillation is. Increase in the risk of stroke. So as you can see, atrial fibrillation or AFib um, is basically an irregular heartbeat. It's the most common form for people. And like I said, it's more common than I imagine. Now, a lot of people who do have AFib are older people, senior citizens, in their 70s, 80s. But I've been finding out that some people as young as in the 30s have AFib. And I would say most people probably know they have AFib, but a good percentage of people actually don't know they have AFib. Now, for me, I knew I had AFib for years. I would say this all started during COVID. Now, I'm not saying COVID caused my AFib. Um, Either COVID itself caused my AFib or the vaccine caused my AFib. I'm not saying that. But I can tell you my symptoms started during COVID. During that time, it was probably my worst year in terms of my health. There was a lot of stress in 2020, stress from opening a new business, stress from losing a business, and stress from the COVID situation. That part I know that I probably had more stress in 2020 than my entire life. So basically, what happened in 2020 was I opened a new business, a new coffee shop. And as you can imagine, it did not go well because we opened the coffee shop 1 month before the shutdown. 1 month before the shutdown. And we barely survived. At the same time, I had a successful social events business where I threw events for people to meet, to make friends, and to, you know, some people they hook up and even got married eventually through my events. So it was a social events business, and because of COVID, it was shut down. Now, after COVID, I had a chance to restarted it, but the ship kind of sailed at that time because I was getting older. I was not healthy. I had AFib. My heart was not in a good shape, and I just decided to not do the business anymore. So 2020, new business, but struggling because of COVID. And my other business, I had to shut it down because of COVID. So I think because of that, that aggravated my heart. Um, it's a little embarrassing, but I should tell you this part. I overdosed taking edibles in 2020. This was just also before COVID. I had edibles before, not often. That night when I took it, I went to a party that I was hosting. And I guess I just wanted to have, I don't know, a good feeling, right, before I started my social event. And I don't know what took over me, but I had, one, two edible, and I didn't feel anything. Like, I didn't feel anything for 15 minutes, 30 minutes. I didn't feel anything. So I start popping, popping more and more and more. I don't know exactly how many edibles I took. And to be honest with you, I don't remember the strength of the edibles, but I took at least half a dozen. Within an hour, I was feeling it. Everything was racing. My heart was racing. My mind was racing. I knew that something was very wrong. I had a friend with me, Jerry, and he also took some of my edibles I gave him, but he only took like half as much. So he was also not doing well. But because I took twice as many, I was a lot worse. So I told him, like, do me a favor, take over the event. I have to go home. So he ordered a um, Uber for me, and within like 5-10 minutes, it came, and I went inside the car. That's when I went to a different dimension in not a good way. When I got into the car and he drove into the highway entrance, in my mind, the Uber driver was going to kill me. I wanted to defend myself. I literally thought I was going to die from him. And in my mind, I wanted to defend myself, so I wanted to stop him from killing me. How? I'm not sure, but I wanted to physically stop him from killing me. But there was a part of me that knew I shouldn't do it, right? There was a part of me knew that I should not resort to violence, even though I was gonna die. So I was about to open the door into the highway where cars were going 60, 80 miles per hour, a few feet away. And at the same time, I felt my heart popping out of my chest, racing. I don't know what's the maximum a heartbeat can beat in a minute. I don't know what that is. I haven't really technically researched it, but it was well over 200 beats per minute. Somehow, I had enough in me to say something to him, for him to help me, even though I thought he was about to kill me. Because there was a part of me that said I shouldn't run out of the car onto the highway, because that was suicidal. A part of me said I shouldn't kill him, even though he was trying to kill me, because that's also bad. So I said to him, 911, 911. And I repeated that probably 30 times. He was a foreigner, I think of Mongolian descent, and he did not know what I was talking about. While all this was happening, it probably took like a minute or less, maybe 30 seconds, which felt like 30,000 years. It literally felt like 30,000 years. Somehow I had the ability to take the phone out of my pocket and with one finger dial 911. When the operator took my phone call, all I could tell her was 911, 911. Just like I said to the Uber driver. And she hung up on me. The Uber driver decided to stop the car on the side of the highway. I sensed he was fearful of his life, but I think he was also fearful of my life. And the level of paranoia finally dropped from a 10 to like a 9 or something like that. And I was able to utter the word hospital. And he realized what I said. And he was like, "You want to go to the hospital?" You know, if I did go to the hospital, I don't think, how should I say this? I don't think I would be better now, if that makes sense. Like the damage was done, right? My heart beat super fast. My brain got altered, whatever, right? My heart tissue got damaged or whatever at that moment. And the level of paranoia kept on dropping though, slowly from 10 to 9 to 8.5 to 8. And then I said to him, "No, go home, take me home." Because I felt if I go to the hospital, it was just been a waste of time. Because the danger zone of me having a cardiac arrest was slowly diminishing, if that makes sense. So I got home, ran toward my wife, told her, "Throw the fuck all the edibles away. Throw it away." And we did that. And since then, I haven't eaten one edible. But I believe the damage was done. To this day, I believe my heart was damaged because of that night. Now, before that night, did I have any heart issues? Was I predisposed to having AFib even before that incident? Possibly, because I remember when I was a kid, there was one incident where I forgot how old I was. I was in grade school. It was either junior high or just before junior high, but 7th grade or 6th grade. That's what I meant. So I was around, 13 years old or so, or 12, whatever. And I remember the gym teacher gave us like the end of the year sort of annual physical test. And part of the annual physical test was to run around the entire block or run around the school. I don't know how many, maybe a quarter mile or less. I don't know, but it was something like that. And so I was pretty young, I felt I was pretty active. Um, I was a skinny kid, but I ate okay, right? And I remember that incident clearly. I was running. I don't know if it was halfway or two-thirds of the way, and all of a sudden I just black out. Like I completely black out. Like I guess I was conscious because I remember I black out. If that makes sense. Like I didn't like fall to the ground, but for couple seconds or a second or two, I just completely black out. I don't know, maybe longer, but it wasn't that long. But I blacked out, and I never experienced that before, or even afterwards, actually. And yes, my heart was racing, right? So that was one sort of incident with my heart, I guess, that was kind of related. And then And then there were a few times when I was working corporate, I think about 5 to 7 years before my overdose incident, there were a few times where I was just at work, you know, working or staring at the computer screen or whatever, or just had a conversation with a coworker or whatever. And all of a sudden I had sort of like an asthma attack. I just had short of breath. This happened like 2, 3 times. I remember I had to go to the I didn't go to the hospital or what do they call those things? Those not free clinics, but those whatever walk-in clinics, right? So I did that a couple times, and they gave me those asthma inhalers, and the doctor said, I don't know, try not to be stressful, right? Try not to be too stressed. Um, but yeah, my heart would be racing, right? I would have short of breath. I would have like sort of like semi or close to an asthma attack. But that was rare. That only happened 2, 3 times. So those 2, 3 incidents plus me blacking out, I don't know, is related to, for me personally, I felt that my heart wasn't the most optimal, but it wasn't like a bad. I didn't feel I had a bad heart, but at the same time, those incidents I felt, like how I don't know how much was mental and how much was like physical, right? But in theory, that my heart what could have been not the best. Anyway, so like I said, I had to overdose. That incident I felt damaged my heart for sure. Because after that was COVID. Lost my business, struggling business, tremendous stress. And then I started having anxiety. Not that I didn't have anxiety before, I always had anxiety. I'm sort of like a ADHD kind of guy. I always had some low level anxiety. Trust me. I'm the type that always fidget with my legs, my hands, whatever. I'm a fidgety kind of guy. I'm the kind of guy that can go from 0 to 100 miles per hour in like seconds. That's me. So I'm very ADHD in some sense, right? And I think because of that, I always had some level of anxiety. But the anxieties I had in the past was manageable, right? Like, okay, I had anxiety, I thought too much, and my heart raced a little bit, but I don't know. I felt like the next day or even the next night or later in the night, I sleep it off or I play basketball or whatever. It feels like it was past. It was the past, right? It was like I had anxiety and it's gone. I had anxiety and it's gone. In 2020, however, the anxiety was every day. And I started noticing heart palpitations all over my body, but especially like around my neck and the back of my head. And it was causing me not to sleep, right? Because think about it. If you try to sleep and rest and just like, buh, 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 like you feel that. You feel the heart beating super strong and super loud on your skin or on your body, if that kind of makes sense. Not right? Like that's kind of scary, I think. And I couldn't sleep a lot. And sometime in 2020, one night, the my heart just felt really weird. I'm pretty sure I had some weirdness in my heart before that night, like afib symptoms before that night. I'm pretty sure of that. But that night though, it was like super weird. It was like I kept on putting my hand on my chest. That's all I can tell you. I kept on putting my hand on my chest. It wasn't like pain, but it was more like I had jolts in my chest, right? It was like and I thought I was gonna die, right? I don't know. I don't know. I thought I was gonna have a cardiac arrest or something, and I was freaking out. I was having paranoia, and So everything was coming together, right? My heart was feeling weird. I had anxiety. I was having paranoia. I was thinking I was gonna die, and so I told my wife I need to go to the ER. So I went to the ER. They gave me some, I forgot what medicine, but basically to calm me down, right? Some kind of narcotics or whatever to calm me down. And I stay overnight. And then, the next morning they're like, "Oh, your heartbeat looks fine, seems fine. It's probably just anxiety." And they told me like basically to de-stress, you know, that kind of stuff. Here are the things to de-stress, right? And they sent me home. But this was one out of three times I went to the hospital. 3 years in a row. 2020, 2021, 2022. Each year, same thing. Each year, I thought I was going to die. Each year, my heart was acting really weird. Now, like I said, my heart was acting weird every day, but especially in those nights, right? When it was acting super weird, when my heart was super regular, and it was causing me to think I was going to die, right? So each time I went to the hospital. And yeah, a couple of times the EMT, they had some monitor on my heart or whatever, and they said that it was regular, right? And 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 in those years, I didn't have health insurance every year because I was a entrepreneur at that time, and insurance was really expensive, and plus insurance really sucked. I remember my wife went to see the doctor for something she had to see, right? And they're like, "Oh, the insurance is like, no, we're not gonna cover you." Like, okay, there's a lump in her body, and they're not gonna cover a screening. Like, you gotta be shitting me, right? Um, my wife had to go to Thailand for that. Isn't that crazy? This is the American healthcare system. You have insurance, and insurance won't cover it, and my wife had to fly to Thailand to get her treatment. I think she has some kind of benign cyst um, near her uterus or something. But anyway, that's why I didn't have health insurance all the time, because when we had it, they were not covering us. And so we're like, okay, why am I paying like $800 a month for health insurance for no service, right? So in those years from 2020 to like 2024 or so, I was on and off with health insurance. And so sometimes I saw doctors with health insurance, sometimes I saw doctors without. And they did give me a heart monitor one year. I think it was 2021, I think. And I had like monitors that's kind of like do it yourself monitors that you can buy, and it says I had afib. But the heart monitor that was given to the hospital, it was Northwestern. But I don't know why they never reach out back to me on what I got. I think because I didn't have insurance. I'm assuming because I didn't have insurance. Um, so I didn't know the results, right? I didn't know the results, but I'm assuming it proved I had AFib, but they never got back to me. And because I didn't have insurance, I'm like, okay, whatever. I just didn't follow up. And my high blood pressure was like 190. I forgot the second part of the number. I always don't remember the second part of the high blood pressure number, but it was 190 over something, right? It was super high. It was at a level of like emergency. They tell you that if you Google it, it's like if you reach close to 200 in your high blood pressure, basically go to the ER. Like go to the ER, you might have a stroke. And that's what I had for like a long time. I had like 190 over whatever for like, I don't know, a couple years, a year or two. I don't know how I'm still alive, I guess. But fast forward to 2025. This time I have decent health insurance. and my heart's not getting better. It's getting worse, right? So I went to see a doctor, my primary, and then she referred me to a cardiologist. And my current cardiologist gave me a heart monitor again. And after I think roughly a week or 10 days or whatever, I forgot exactly how many days, but a week to 2 weeks of heart monitoring, he told me that I had 20% AFib. What he meant was 20% of the time, the heart monitor said I had AFib symptoms. Yeah, I believe that because I felt AFib every day. Now, here's the thing when I'm working, when I'm doing some working or exercise, usually I don't feel AFib. I usually only feel AFib when I'm like not distracted, right? Like usually I feel AFib when I'm reading an article, watching TV. I always have AFib when I lie in bed. Like the beginning of the sleeping process, I would have AFib. And my doctor said that's kind of common. Now, I'm assuming when you're distracted, I have a feeling AFib, a lot of it's mental, right? Like when you're not distracted, you're thinking or you're reading something, it triggers something, right? It triggers something. And so you're thinking about something that is not in a good place. It could be in a subconscious level, right? And that triggers the AFib. So to me, that makes sense. So my doctor gave me some heart medication at first for AFib. Um, I think to calm the heart down a little bit. Of course, I had high blood pressure medicine that lowered my blood pressure from 190 to right now currently is like 115. So good numbers, I guess. And that lowered my heart palpitations a little bit. And but it didn't really lower my AFib level though. What I'm trying to say is my heart palpitation was still there. I still have it actually, but it just wasn't as pronounced, if that makes sense. When my high blood pressure was super high, and before I started taking the medicines, it was like super high. Like I could feel my heart palpitations like it was gonna pop, right? My I just felt like my heart was gonna pop. With the medications, I still feel it, but it was just less. It was less pronounced. But the other parts of AFib, like sometimes when I feel like my heart stops and it restarts and I get this jolt, it's the scariest thing. It's like I'm doing like this and all of a sudden it's like, what the hell happened? Why is my heart just kind of like popping out of my chest? I'm assuming my heart stopped. And my doctor did say that during the heart monitor results, a few times my heart did stop for 2, 3 seconds. So, yeah. So I was on the heart medication for much of, I would say, at least half of 2025. I think I started taking it in the spring. And by fall of 2025, my doctor asked me if I felt better, and I said, not really. I mean, heart palpitation, I feel a little better, but I still have AFib. And so he gave me another heart monitor, and the second heart monitor results prove it. If anything, it got worse. So he suggested I take heart ablation surgery. Now, what is heart ablation surgery? Well, at first, when he told me about heart surgery, I was scared, right? He told me that heart ablation surgery is not open heart surgery, it's minimally invasive, and it has a very high success rate. Now, when they mean success rate, what they mean is like you're not gonna die from it. That's what they mean, right? It has a high success rate that in a sense that you're gonna go into the surgery and come out of it alive and not injured, right? That's what they mean by success. In terms of like solving your AFib, it's more nuanced, right? Heart ablation surgery is not a cure for AFib. Now, is it possible that someone had heart ablation surgery and they don't feel AFib for many, many, many years, if not decades? I think it's possible, but technically it's not a cure. A lot of people, I would say maybe most people feel better after heart ablation surgery, but many people would still experience AFib months later, years later. But yes, maybe their experience of AFib is less than before. Or if it gets worse, some people have multiple heart ablation surgeries, right? So, and I did my research on what heart ablation surgery is. Um, I'll try my best to describe what it is. I'll include some links for you to read or watch. Um, but basically, what they do is they insert two catheters from the pelvic area through the vein and into your heart. One of the catheter is to map your heart, and the other catheter is to basically to scar your heart. So the ablation surgery that I had was thermal. I think there's two types of thermal. One is cold and one's hot. Um, the one that they did to me was basically using radio frequency. So the catheter basically goes up to my heart. I believe it goes through the right atrium and punctures to the left atrium. I could be wrong, but it actually punctures in my heart. So it sounds scary, right? Um, but you don't feel it because you're doing a surgery. You're sleeping, right? You're knocked out, and basically the catheter will then use heat to scar your heart or kill the cells that is causing the irregular heartbeat. Um, so this when my doctor explained this to me, right? On the surface, it didn't seem scary. He said that every day, 1,000 people are probably having ablation surgery, and 99% of them come out alive or not injured, right? But I don't know. I was scared. I was scared. The idea of being in an operating room, having some foreign objects going up your body and into your heart, it's sounds scary. So I told him to go ahead and let's make an appointment because I knew the alternative was that my AFib was not going to get better, right? The medication didn't really help, to be honest with you. Like, it helped my palpitations a little bit, but it didn't really help. So I waited, I think, about 3 months before the surgery, and it was kind of nerve wracking. And there was always a thought that I was going to cancel it, right? Because I didn't want to do it, to be honest with you. I didn't want to do it. I prefer not to do it, right? I prefer there was a miracle drug, but I knew there were no miracle drugs. So I at the same time I knew I had to do it, right? So as the days came closer, I came to accept that I had to do it, and I told myself the data should reassure you, right? The data should reassure you in the sense that you will come out alive. You shouldn't be worse than you are, right? Now or before the surgery. And that 1% or less than 1% chance of not having a successful surgery, you just have to take that risk because I couldn't live myself thinking I'm going to die while I'm just sitting on my sofa like every night or every week, right? It's just not a way to live. So, the ablation surgery itself was pretty interesting. Now, I don't know if you ever had surgery where they gave you anesthesia and you're just knocked out. It happened to me once before my heart ablation surgery. I had a colonoscopy. And I was also nervous for the colonoscopy. As you can tell, I'm a nervous guy. I think what makes me nervous and a lot of people nervous is the idea of or knowing that you have no control, right? You have zero control on when they put you to sleep and when that you wake up. You have no control. You have no control, right? So it's it's the fear playing with you, right? Am I going to wake up? I have no control over it, that kind of thing. But I went through with it because I knew it was silly not to go through with it. And they told me I should start having one, my first one. So I had my colonoscopy. They gave me anesthesia, and yeah, I was knocked out, right? And it was the weirdest thing because I remembered. I was having it. They put me in the room. I was having a conversation with the doctors and nurses, whatever. And I remember they were starting to put the drug in me, right? And and slowly I felt something heavy, I think, around my shoulder area, and then I blacked out, right? And then I woke up in a different room. So that was kind of odd. That was weird, but that was kind of expected, you know? So when I had that experience, I said to myself, "Oh, okay, that's what it feels like to get knocked out." Like that was kind of expected. For my ablation surgery, I was in a waiting room. Doctors, nurses visit me, asking me how I'm doing, checking my vitals, all that. I was there for like 1 hour, right? And then after that, after the waiting room, they sent me to the operating room. It's basically a table, operating table, right? They put me there. I remember this clearly. They put me there. I'm trying to light things up. So I said a joke to the doctors and nurses, and I said, I guess I don't have to worry about anything anymore. All my worries are going to be over now. And they realized the joke, and they're because the joke was that I was not going to wake up from this, so all my worries are going to be over. So they said, "Oh, you're pretty sarcastic, very funny, ha ha ha." So they laugh, blah blah blah. But unlike my colonoscopy, I remember it was more of a gradual process. It was more, I just remember, like all of a sudden, like for a second or two, things were getting heavy and I black out. This one, I told a joke. I remember telling the joke, people laughing about it, and then next thing I know, I hear commotion. I hear commotion of like, move here, and I'm like, what the hell's going on? And like, why are people pushing the bed that I'm on? And then I realized they're moving me back to the waiting room. I'm like, okay. I realized the operation was over. I'm assuming, right? And I asked them like, oh, what time is it? They're like, oh, it's like, I don't know, 12 o'clock or something. But I remember when I left the waiting room, it was like 9:30 a.m. I'm like, so the ablation surgery is over? They're like, yeah, successful. It was a success, right? Ablation surgery is over. So I was really weirded out by that experience because unlike the colonoscopy, I felt that was more of a natural. I don't know, the way I was put to sleep, it just felt more natural. Where my ablation, either I had memory loss, right? I wasn't fully knocked out, but I had memory loss between my joke and when they fully knocked me out. Or I didn't know at that time, but they put the drug on me and before the joke, and I was knocked out right afterwards. But I felt that was almost impossible because I remember telling the joke literally a minute when they put me onto bed or onto the table. So anyway, I thought it was an interesting story about the heart ablation surgery. Um, the first few days after surgery, I didn't feel good, to be honest with you. I wasn't happy because I remember I was in pain. Not where they put the catheter, near my pelvic area. Not there. I didn't really feel that much pain there, to be honest with you. There were a lot of bruises. There it was probably very bloody because there was like it was red all over. There was bruises over. No, the pain was at my chest. I felt like my heart was very sore. Like that's the only thing I can describe. It's like my heart felt very sore, and I was having pain, and I believe I was still feeling a little afib symptoms the first few days. So at first I thought the heart surgery was a failure because I just didn't feel good. My recovery wasn't good. And I almost wanted to call my doctor and ask him about it or go back to the hospital because it was kind of like that bad almost. But I didn't. And I'm glad I didn't because I think by the fourth, fifth day, I got better. The pain kind of went away and my heart got less sore. And maybe over a week or two later, it felt kind of normal. Now, what does normal mean for me now? I still have AFib. That's the bad news. I still have heart palpitations. I still have irregular heartbeat. And sometimes I still feel my heart beating fast. Now, I am happy I had the surgery though, because despite still feeling AFib, now I haven't had a monitor on me since my surgery, but just based on my knowledge of what AFib is and how I what I felt when I had AFib in the past to now, I feel like my AFib now is much better though. Much better in the sense that it's probably not 20-25% of the time. If I have AFib, it might be like 5% of the time now. to be honest with you, I probably have AFib, if not every day, almost every day, but only 5% of the time. So that's a huge improvement for me, from 20 to 25% to 5%. And because I know the doctors told me that AFib is heart ablation surgery is not a cure, that was within my expectation. That, like, as long as my AFib level, the number of symptoms drop or drop significantly, I'm happy, right? So I knew it wasn't a cure, and from 22% to 5% to me is a big improvement, and I'll take it. Is there a way for me to improve further? I'm not sure, to be honest with you. Like I said, I haven't really done much exercise for a while. A lot of it's because of my fear, right? And what I mean by fear is like I fear my heart is not well. So I'm afraid to do like, I'm afraid to run. I'm afraid to go back to playing basketball. I'm afraid to doing heavy lifting because I'm afraid my heart is not able to take it. So I think I need to get out of this fear and slowly start building up my heart's confidence, right? So I haven't done it yet, but I would like to do more exercise, right? Obviously, slowly, maybe walk more, and from walking to jogging a little bit, playing light basketball, maybe light weights, and see how my heart reacts from that. And if my heart reacts well from that, then I feel like that is my next step in my AFib treatment, right? Maybe that will also give me more of a better mental health as well. Because I really feel that AFib symptoms, a lot of it's derived from your mental well-being versus your physical deterioration. So yeah, um, that is my AFib story. Um, it's not it's not fun. I'm sure some people's AFibs are a lot worse than mine. I wish that on no one. Um, and to some people, I forgot to mention this, but some people do have AFib and they don't even know it. I have a nephew in China. He had an ablation surgery. Now, Chinese healthcare is out of this world, by the way, if you guys didn't know it. When I told him about my my dealings with my doctors and hospital and my treatments, they're in a shock. Like, it takes you that long to have a surgery. Like, literally, when the doctors told him he had AFib, he had surgery a few weeks later. Like, but the but he didn't know he had AFib. He had testing done, right? He had testing done, and they told him like, oh yeah, you have AFib, and he said that he didn't really feel the symptoms. So for some people, I'm assuming maybe they're on the younger side, and also they're in their earlier stages of AFib that they don't really feel AFib. Where for some people like me, it's very pronounced, and when that happens, especially when you have heart palpitations constant basis, and sometimes your heart having a jolt, um, that plays with your mind a lot, and it's like a vicious cycle, right? The more it plays with your mind, the more it triggers the AFib. So if you feel your heart is irregular, please check it out. Um, for some people, medications help. And if it doesn't help, because I just had ablation heart surgery 5 months ago and I feel a lot better, that should help you. And if you are considering heart ablation surgery, I understand if you are scared. It's very normal to be scared. But I can tell you that based on my experience, it's worth it. And it's it's a quick, fairly painless procedure. Procedure's painless, but you might have some recovery time like I did. So, but that usually lasts a few days. So I hope this video helps you out a little bit. Um, I know that it's not easy dealing with this, and I hope that you can get better. Thank you.